Hi, Annie Boggs here, and I have Mrs. Smith, and we are going to demonstrate a treatment option using Lee Silverman's voice therapy, something called the speak out or loud therapy. Mrs. Smith presents with laryngeal tremor secondary to Parkinson's disease. The first thing that we're going to do is we're going to get a fundamental frequency of her pitch, and we're going to do that right now. Mrs. Smith, can you say E for me, please?
E.
Nice job. And then Mrs. Smith, will you say ah for me, please?
Ah.
Okay, again E.
E.
Again ah.
Ah.
Very nice. All right, I'm getting G3 to A3 to F3. Mrs. Smith, what we're going to do next is we are going to see in your normal voice how many decibels you are saying E and ah. If you'll go ahead and do that, go ahead and go E.
E.
Very nice. And then go ah.
Ah.
Very nice. Thank you. And sustain that for just a little bit longer. Ah.
Ah.
Very nice. Okay. Now that was between 55 and 63 decibels, which is quiet to normal. And what we're going to do with the Lee Silverman's voice therapy is we're going to increase your decibels to about 80. So what I want you to do is I want you to go E, but when I go like this, I want you to increase your loudness. Okay. Go ahead and go E.
E.
Very nice. Right about there is 80 decibels. And then same with the ah.
Ah.
That's very nice. Okay, so what I want you to do using that loudness, I want you to say, my name is Mrs. Smith. Go ahead.
My name is Mrs. Smith.
Very nice. That's right within the decibel range, which is the loud 80 decibels. Okay, now what we're going to do is we're going to take the tuner and we're going to see exactly where your pitch is again. Okay, here we go. If you'll say, my name is Mrs. Smith, using that same exact loudness, I'm going to tell you where you're at with this. Here we go.
My name is Mrs. Smith.
Very nice. Okay, now that went down an octave. I want you to kind of stay at your normal pitch, okay, using that loudness. Here we go.
My name is Mrs. Smith.
Very nice, very nice. And you were recorded at 80. That's excellent. You stayed within that G3 to F3. Thank you, Mrs. Smith.
Thank you.